What's up, guys? I've got a couple minutes before the craziness of the day gets started, so I'm going to answer some questions that came in through Facebook Messenger. This is from a therapist who had questions about getting started in private practice. The first question is, can you bill for mobile services or services provided in a public gym or home gym without having a clinic address? So if we're talking about Medicare Part B specifically, once you're contracted as a par or non-par provider, you are allowed to deliver services to a Medicare beneficiary under Part B coverage in the patient's home or in a clinic that you own, rent, or lease. Those locations have to be indicated on your initial enrollment. So when you're submitting your Medicare Part B application, you would indicate that either all of your services are delivered only in the patient's home, or that they're delivered in the patient's home and you have a physical location. But what you cannot do is you cannot deliver services, say in a YMCA or an LA Fitness, if you're not leasing part of that space and you have exclusive use of the space that you're leasing, and you've included that space on your initial Medicare application. So if you want to do stuff like that, if you want to go to the patient's gym, if you want to go to their business site, their employment site, if you want to go out to a park, those would be non-covered services under Medicare Part B. Now, there are other insurance plans that might allow you to do that kind of thing. There are some workers' comp plans that if you negotiate with the case manager, perhaps you could go on site where the worker does his or her job and you can deliver physical therapy there. But generally speaking, you're limited to covered services being delivered in a clinic you own, rent, or lease, and for Medicare Part B, and or in the patient's home. So let's hit one more and then we'll move on. Or does telehealth have to occur on a certain type of platform to be considered telehealth, or can you use something like FaceTime? So there are some articles that I found that would suggest FaceTime is HIPAA compliant. They would suggest FaceTime is encrypted. But I would tell you that the general consensus is FaceTime is not a HIPAA compliant platform, that you do need to provide, if it's telehealth billed through insurance, if you're a covered entity, you do need to provide those services on a HIPAA compliant platform. Now, there's lots of free platforms out there. I used to use Doxy for a long time. ClockTree was another one that I've used. Right now I'm using vc.com. So you can get started for free. They're great. The quality is awesome. A lot of EMRs now are offering free add-ons for telehealth or a small fee for telehealth capability. But yes, if you're billing to a third-party payer, you are a covered entity. You do need to provide those services on a HIPAA compliant platform. So guys, if you like questions and answers like this, let me know in the comments below. I've got a couple more. I'm going to throw them onto the next video. I'll see you there.